Hello everybody, this is the full video for how to run a Part D prescription drug plan analysis for 2024. So what you do is you go to medicare.gov. We are already on the website, but just in case, you can see here, medicare.gov. It could look like this, it could have other people on it, but just know you want to go to the official government website and you will see that in the upper left-hand corner. Now once you're on medicare.gov, you simply go to log in. Now, many of you may already be familiar with this process if you've done this last year or if you've already made a Medicare.gov account, but you will enter your username and password to actually do the login. However, if you have not made an account already, you can go to create account. So I'll just click on that, and then basically you go through this process. We do have a PDF or a document that shows how to do this step by step, but just be aware that if you do not have an account, that is where you will create one. So now we will go through this, assuming you already have an account. Again, you will enter your username and your password right here, as you can see, and you will click login. Now, once you've logged in, it will take you to your home page for your personal Medicare.gov account. Once you are in here, what we are going to do is first update and check your list of prescription medications. Now, keep in mind, you can see your current plan coverage and everything will be listed towards the bottom of this page, but for now, we are just focused on Part D prescription drug coverage. So what you can do is you can go to open all options. You may also be able to go to health and drug plans, but for now, we'll stick with what we know. So open all options. And you will see an option right here that says update my saved drugs. So click on that. Now, when you're in here, you will see your list of saved prescriptions. Now, if you've filled medications with your Part D plan in the past, these might already be in here. You might see some that are not current medications of yours, or you will need to add some. So let's pretend you do not take this losartan medication anymore. You can simply remove it by clicking remove drug. And now we are left with just finasteride. But let's assume that's not your only medication. Now you have to add another prescription. So you simply go here, you can click add another drug. When you do this, let's put in a medication. We'll say you're doing levothyroxine. So right here is where you type the name. It will have a bunch of options that pull up, but levothyroxine sodium is what we're looking for in this case. And then you go to add drug. Now, once you go to add drug, this is where you do the dosage, the quantity, and the frequency. So the dosage is basically the strength. So is it and you really want to make sure here if it's a capsule versus a tablet, you have to be absolutely sure which one you're taking. Look at the bottle or look at the actual medication when you're doing this to make sure. Most people take the tablet and then the capsule is more expensive, so you get surprised if you accidentally choose the capsule. So for this, we'll say you do the 100 mcg tablet. Again, the dosage is the strength. Now the quantity is the amount you take per the frequency. So we'll do 30 or let's just change it just for the sake of it. So let's say you do one tablet per day, but you get a 3-month supply. So that would be 90 tablets, and that would be every 3 months. So the frequency is how often you're getting it filled. Then you do add to my drug list. So now you basically repeat that process for every medication that you have that you plan on taking in 2024 or that you realistically think you might have to take based on conversations with your doctor. Don't forget medications like inhalers and other things that you do not use as often but you may need to have filled, especially things like creams and shampoos and other medications like that. So now let's just add one more as a practice. So when you go here to add more, let's try insulin. So this is really important. If you take an insulin, let's say you do the Lantus type of insulin, you'll want to choose Lantus, add. Now, if there is a generic version, you can click add generic. A lot of people take the brand name for these kind of things, but it will prompt you. So make sure, again, like we're talking capsules versus tablets and creams versus solutions, you really also want to make sure that you're saying generic versus brand name medications. So this one will do keep the brand, and then you're going to have to figure out, okay, what is my solution like? Do I use a pen injector? And will I have this 3 milliliter pen sold in a pack of 5, or do I just get one pen? But you just kind of want to do the math here. So this one is saying that you get a pack of 5 of these 3 milliliter pens, one pack every month. So just for the sake of this, we'll add that to the list. And this will also remind you that the new insulin benefit is in effect, so you should not have to pay more than $35 for a 1-month supply if the insulin is covered by your plan's formulary. So here we'll have this as our list for now, and we will start a new plan search. So once you have your list fully updated, you can go to start a new plan search. Now, once you're here, it will show your current coverage. So for this one, it's a WellCare Value Script prescription drug plan. That's what PDP stands for, and that is a plan that you currently have for 2023. Yours could obviously be different based on the company that you have. Now, it also says if you do not make any changes for 2024, you will remain with that same plan if your plan is still being offered for the next year, which most of them are. So now we want to compare your current coverage to potential other options. What you do is you can scroll down. You also want to check your pharmacies. If you want to add a pharmacy, you can also click on that and you can add another pharmacy. So once you're here in the add a pharmacy, let's say you also want to check Walgreens and even mail order. So you can do that and click done. Now that you have all your pharmacies listed, click OK. And just keep in mind, you can also keep it at just the one pharmacy if you are strictly only planning on using one and you do not want to look at any other options. But just keep in mind, pharmacies are different with each plan and you might save by looking at other options. So we have pharmacies, we have that drug list we entered. Just double check that one more time, make sure it's accurate, and then you do find plans now. So now we want to make sure we're looking at 2024. You have your zip code and then you click continue. And then after that, you will pick Medicare drug plan, which is Part D, and click find plans. And this is the bulk of the analysis here. This is one of the more important parts besides making sure your medications are entered correctly. What it will show is it will show your next plan. And what it means by your next plan is it's basically saying if you don't do anything, this is the plan you'll be enrolled in for the upcoming year. So you can see here the overall estimated cost is very high with this one. This is taking account your premium. So this plan actually has no monthly premium, and it's taking into account all of your estimated prescription drug costs. So this one, I'm assuming it doesn't cover the insulin. That's what makes it so high. So we want to look at other options. It also includes your deductible. So when you're sorting these options, this is the number you want to look at. So now we scroll down. And then what it does is, it compares your current option. So if you stay with your current plan for next year, these are your estimated total cost. And again, that's when you're actually filling the prescriptions. Now, if we scroll down, it's going to show the plan that is actually the next lowest, or it is the lowest projected overall cost. So there are situations where this plan, your next plan, will be the same as this plan, which is also the plan with the lowest projected cost. Essentially what that's saying is it's very likely you'll want to continue with your current plan for next year. However, in this case, it is showing that there is another plan that might save you more money and significantly more based on those numbers. So again, we're talking about $6,248 estimated out of pocket versus only $483. That is a huge difference. And now at this point, go to this one, which is your next plan, and click plan details. Once you're in here, this will break down all of the details for that plan. So that again, it has premiums, deductibles, everything you should need to know. And what you want to do before you do anything is just scroll down. And you're going to see a section here where it says estimated drug costs, and there's different plus buttons. So go plus here, plus here, plus here, plus here. You really don't need to know exactly what that does. It just gives you more details. Having all of this information is super helpful because here you can see insulin. This specific insulin is not covered by this plan. That's what's making it so expensive. Now that we have that, we'll just scroll back up to the top. And this is, again, all the information that we need to see. If you do want to change pharmacies, you can actually do that. If you want to look at other ones, you can see here Walgreens and CVS are preferred pharmacies. But let's say you wanted to take a look at others. Then you end up clicking that change pharmacy button, and it will show you other preferred pharmacies or not preferred. So Rite Aid in this case is not a preferred pharmacy. We can add it just to show you how that looks and then do done. Okay, so you have all of that. So again, a lot of it comes down to the overall estimated cost for the prescriptions. Keep in mind when it does come to the deductible, a lot of people get concerned when they see $545 or a large amount, but there are a lot of prescription plans where the lower tier medications, it might be tier 1, might be tier 2, those might not apply to every plan's deductible. So just be sure you're actually looking at the estimated cost for the prescriptions when it comes to this. For example, the levothyroxine, it's still showing no cost even with the deductible. So that is always good to keep in mind. And then if we end by just going to this main screen again, you will see, again, you have your next plan, and you're just going to want to compare these overall costs. So you can scroll down as much as you like. You can see as many plan options you would like. You can also check to make sure your medications do not need prior authorization or certain quantity limits that are unique for your medications. So with that all in mind, you're really trying to compare your current coverage to what is being estimated as the lowest overall cost going into next year.